set aside
more that our health
technology
system
silos
focuses
to
on the
have
social
some
talked about the
services.
state of healthcare.
Keep that off.
You talked about, you used the word engagement. And I hear that often with regard to patient engagement. But I think you were referring to physician engagement. Physician engagement in the process, physician engagement in the system. Why is that so important?
We're the ones who are on the ground helping our patients be better and be healthier. There is no group of people in our society who have as much knowledge about safety and efficacy of medical care as do the physicians. To a large extent, physicians have been stymied. We're stymied by a never-ending rain of rules and regulations that come down from the state and federal government. We're stymied by changes that occur for the different health plans and health insurance companies who have a variety of different formularies, different requirements for protocols of care, first trials of therapeutics, and more of a physician's time is spent trying to clear the clutter away of regulations and third-party payer requirements than is spent taking care of the patient. And that concerns me. And I think that if we want to evolve to have a better system, that physicians need to be involved. And all too often I hear criticism of our medical associations. What has the medical association done for me? Well, the best thing it can do for you is it gives you an avenue to participate, to bring your concerns forward, and to have the association represent those concerns. So all too many of our colleagues are neglecting this great opportunity that they have to improve the lives of their patients and to improve their work life. So if anyone ever watches this, I would encourage them and to treat them to not only be a member, but to be an engaged member. I think it's critically important for us to take responsibility to help develop the healthcare system of the future.
Thank you. Dr. Seuss, you're the incoming president of the California Medical Association?
I'm the chair of the board of the California Medical Association.
Chair of the board. Thank
I'm
you.
running for president-elect in October.
Okay.
Whether that's going to be successful, you never know.
Good luck with that. Obviously, medical associations on the county level and the state level depend on physician engagement. That's critical. Can you give us some insight into what you see from up on top, so to speak, at the California level regarding the state of physician engagement? Is it declining? Is it increasing? Are there areas where physicians need to be more engaged than they are? Can you give us some overview of that?
So overall, physician engagement, if we define it as membership in our associations, is increasing. The Los Angeles County Medical Association is an excellent example of that, where our membership growth has been roughly 30% year over year in the past year. Much of that is attributable to our outstanding executive leadership, but I'm hoping that it's also representative of the fact that physicians to some degree may be recognizing the importance of being involved with their organizations if they want their point of view represented in the legislature and Congress, and even more importantly, to their own hospital administrations. One of the critical issues we face in California is the maintaining an independent medical staff at each hospital. As hospitals become employers of physicians, it is important that the medical staff remains an independent voice for best practices of medical care as opposed to most profitable practices of medical care. So that's one key issue. A second key issue is that physicians are best able to tell the stories about what's impacting their patients. So while we hear about the cost of pharmaceuticals having an impact to each individual patient, physicians are there on the front line dealing with patients who can't afford to get their medicines, or patients who are obstructed from getting their medicines because they're no longer on a formulary where they were on the formulary the previous month, or deductibles being so high for the pharmaceutical agents that the patients can't afford to purchase their medicines. So physician engagement is important if we want to help our patients get the best possible care. And then finally, in terms of globally from the California Medical Association, if we don't have strong membership in our local county medical associations, then the California Medical Association can't function effectively. And counties are in a very good position to represent their physicians locally. They can develop relationships with their county departments of public health. They can develop relationships with their hospital associations. And so they can do things on a more global scale than an individual physician can. I think it's critical that physicians maintain membership in their associations because there is really no one else who can represent them effectively other than representing themselves as an individual, but no one who can represent them effectively as a group.
When we have widespread physician engagement, how does that voice of the collective voice of physicians play itself out? Give me one example, if you will, please, if you can, of something that has happened in recent time where the voice of the physicians have been persuasive to their benefit.
Well, an excellent example was Prop 46, the MICRA initiative, where the trial attorneys 2 years ago tried to overturn MICRA in the state of California, which would have had a major impact on the cost of care, both in terms of the awards in litigation, but something that percolates throughout the entire system in terms of defensive medicine and access to care for patients. So the effectiveness of the California Medical Association and its constituent societies resulted in that proposition not passing, and in fact not succeeding in any single county in the entire state. That kind of victory would have not been achievable if physicians did not engage with their association and work together to ensure that the trial attorneys weren't successful.